Understanding male circumcision, benefits, risks, and facts. Hello everyone, and welcome. Before we begin, a quick note. This video discusses a sensitive health topic. Our aim is to provide clear, factual information in a respectful manner, but viewer discretion is advised. I'm Phoebe Boco, and today we're taking a deep dive into a subject that has been discussed, debated, and sometimes misunderstood for millennia: male circumcision. This practice is performed on a significant portion of the male population worldwide, yet the reasons behind it are incredibly diverse, spanning medical, cultural, and religious traditions. In this episode, we're going to explore everything you need to know, from the potential benefits and risks to the science behind the procedure itself. Whether you're an expecting parent weighing this decision for your newborn, an adult considering the procedure for health or personal reasons, or simply someone curious to learn more about this widespread practice, you've come to the right place. Our goal is to equip you with balanced, evidence-based information so you can feel more informed. So sit back, relax, and let's break it all down, step by step. What is circumcision? Let's start with the basics and clarify some key terms. Circumcision is the surgical removal of the foreskin, which is the retractable fold of skin that covers the head, or glans, of the penis. This procedure has ancient roots, with evidence of it being practiced in various cultures for thousands of years. The reasons for performing circumcision are varied. Medically, it can be a treatment for conditions like phimosis, where the foreskin is too tight to be pulled back, or paraphimosis, a medical emergency, where a retracted foreskin gets stuck. It's also used to address recurrent balanitis, which is inflammation of the glands. Beyond these specific medical indications, circumcision is often performed for preventative health reasons, which we'll explore in detail later. It also holds deep significance in many cultures and religions, such as Judaism and Islam, where it is a fundamental right. The procedure itself differs depending on the patient's age. For newborns, it's typically a quick procedure performed by a trained professional, often using local anesthesia to minimize pain. For older children and adults, it is a more formal surgical operation that may require sedation or general anesthesia. Recovery also varies, but most individuals heal completely within a few weeks with proper aftercare. Throughout this video, we'll maintain a neutral stance, focusing on presenting the facts as understood by the medical community today. Benefits of circumcision. Now, let's delve into the potential benefits of circumcision. The decision to circumcise is a complex one, with cultural, personal, and medical factors all playing a role. In this section, we'll focus specifically on the medical advantages that have been identified through extensive scientific research. It's important to note that while many major health organizations around the world acknowledge these benefits, their recommendations often vary, reflecting the nuanced nature of this topic. The consensus is that the health benefits are significant enough to warrant consideration and discussion with a healthcare provider, but not so great as to recommend routine circumcision for every newborn male. With that context in mind, let's explore the evidence. 1. Reduced risk of urinary tract infections, UTIs. One of the most well-established benefits, particularly for infants, is a significantly reduced risk of urinary tract infections. UTIs, while more commonly associated with girls, can affect infant boys, and they are notably more frequent in uncircumcised infants. Studies have consistently shown that the risk of developing a UTI during the first year of life is up to 10 times lower for circumcised boys. The foreskin can create a warm, moist environment where bacteria, including those that cause UTIs, can colonize more easily. These bacteria can then travel up the urethra and into the bladder, leading to an infection. While most UTIs are readily treatable with antibiotics, they can be quite distressing for an infant and concerning for parents. In some severe or recurrent cases, a UTI can lead to more serious kidney infections, a condition known as pyelonephritis, which may cause lasting kidney damage. Therefore, by removing the foreskin, circumcision effectively reduces the local bacterial load and lowers this specific health risk during a vulnerable period of early life. 1. Lower risk of sexually transmitted infections, STIs. A substantial body of evidence, including large-scale randomized controlled trials, indicates that male circumcision can significantly reduce the risk of acquiring certain sexually transmitted infections, particularly in heterosexual men. The World Health Organization and other public health bodies have recognized its role as a preventive measure. especially in regions with high rates of HIV. Specifically, research shows that circumcision can lower the risk of female-to-male HIV transmission by approximately 50 to 60%. It also reduces the risk of contracting human papillomavirus, or HPV, which can cause genital warts and certain cancers, as well as herpes simplex virus type 2, the primary cause of genital herpes. The biological reason for this protective effect is thought to be related to the structure of the foreskin itself. The inner surface of the foreskin contains a high concentration of specific immune cells, like Langerhans cells, that are particularly susceptible to being targeted and infected by viruses like HIV. Removing this tissue removes a key portal of entry for these pathogens. It is absolutely crucial to understand, however, that circumcision is not a substitute for safe sexual practices. It offers risk reduction, not complete immunity. The consistent use of condoms remains the most effective way to prevent the transmission of STIs. 1. Prevention of penile problems. Circumcision effectively prevents several medical conditions related to the foreskin. The most common of these is phimosis, a condition where the foreskin is too tight to be retracted back over the head of the penis, or the glans. While a tight foreskin is normal in infants and young children, it can sometimes persist into adolescence and adulthood, causing pain, interfering with urination, and making hygiene difficult. A more urgent and painful condition is paraphimosis, which occurs when a tight foreskin is retracted, but then becomes trapped behind the glans and cannot be returned to its normal position. This can cut off blood flow to the tip of the penis, requiring emergency medical intervention to prevent tissue damage. Furthermore, circumcision reduces the incidence of inflammatory conditions like balanitis, which is an inflammation of the glands, and balanoposthitis, an inflammation of both the glands and the foreskin. These infections are often caused by poor hygiene or bacterial or fungal overgrowth under the foreskin. By removing the foreskin, circumcision eliminates the possibility of these specific problems occurring. 1. Penile cancer risk reduction. Although penile cancer is a very rare disease, particularly in developed countries, studies consistently show that the risk is substantially lower in circumcised men. Some research suggests the risk may be reduced by more than threefold. The exact mechanism for this protective effect is believed to be multifactorial. A primary factor is the prevention of phimosis, which is a known major risk factor for developing penile cancer. Chronic inflammation and infections under the foreskin, which are more common in uncircumcised men with poor hygiene, are also associated with an increased cancer risk. Additionally, as mentioned earlier, circumcision reduces the risk of acquiring high-risk strains of HPV, which are responsible for a significant percentage of penile cancers. While the absolute risk of developing this cancer is low for any individual, the dramatic reduction in relative risk is considered a significant long-term health benefit of the procedure. 1. Hygiene and cleanliness. One of the more straightforward benefits of circumcision is simplified genital hygiene. Without a foreskin, the glans is always exposed, making it easy to wash and keep clean during routine bathing. In an uncircumcised male, proper hygiene requires retracting the foreskin and gently cleaning the area underneath to prevent the buildup of smegma. Smegma is a natural secretion composed of shed skin cells and oils from sebaceous glands. If it accumulates, it can develop a strong odor and create an environment conducive to bacterial growth, potentially leading to irritation, inflammation, or infections like balanitis. While good hygiene is perfectly achievable for an uncircumcised individual, circumcision makes the process simpler and less prone to issues arising from inadequate cleaning. This can be a particularly relevant consideration for parents of young boys, or for individuals who may have physical limitations that make detailed hygiene more challenging. 1. Potential benefits for sexual partners. The health benefits of male circumcision can also extend to female sexual partners. Research has found that women whose male partners are circumcised may have a lower risk of developing certain health issues. Most notably, this includes a reduced risk of cervical cancer. This connection is strongly linked to HPV. Since circumcised men are less likely to acquire and transmit high-risk strains of HPV, their partners are subsequently less exposed to the virus that causes the vast majority of cervical cancers. Beyond HPV, studies have also suggested a lower incidence of other conditions in female partners, such as bacterial vaginosis and trichomoniasis. The theory is that the area under the foreskin can act as a reservoir for various microorganisms, and its removal reduces the overall microbial load that can be transferred during intercourse. thereby helping to maintain a healthier vaginal microbiome for the female partner. 1. Cultural and religious significance. Finally, it's essential to acknowledge that for millions of people worldwide, the decision to circumcise is not primarily a medical one. It is a deeply ingrained cultural tradition, or a religious obligation. In Judaism and Islam, for example, male circumcision is a fundamental rite, symbolizing a covenant with God and serving as a core component of religious and communal identity. In many other cultures, particularly in parts of Africa, Australia, and the Pacific Islands, it functions as a traditional rite of passage, marking a boy's transition into manhood. For families within these communities, the procedure is a powerful act of cultural affiliation, connecting an individual to his heritage, family, and social group. This social and spiritual significance is a powerful and valid reason for the practice, standing alongside and often taking precedence over any medical considerations. Understanding this context is vital for a holistic view of why circumcision remains such a widespread practice globally. Risks and considerations. While circumcision is a common and generally safe procedure, it's essential to approach the decision with a full understanding of the potential risks and considerations. Like any surgical intervention, it is not entirely without downsides, and a balanced view is crucial. Let's explore these aspects in more detail. First, let's talk about surgical complications. The most common immediate risks are bleeding, infection, and pain at the surgical site. Fortunately, these are typically minor and manageable. Pain is controlled using anesthesia, such as a topical numbing cream or a local anesthetic injection, making the procedure itself more comfortable. Post-procedure discomfort is usually mild and can be managed with simple care routines. More serious complications are rare, especially when the procedure is performed by a qualified and experienced medical professional in a sterile environment. These can include excessive bleeding or a more significant infection requiring further medical treatment. Other, less common long-term issues can include scarring, adhesions, where the remaining skin incorrectly attaches to the glands, or meatal stenosis, which is a narrowing of the opening of the urethra that can affect urination. While these outcomes are infrequent, they underscore the importance of proper technique and diligent aftercare. Another important consideration is the potential impact on sexual sensation. The foreskin contains a high concentration of nerve endings, and its removal will naturally alter the sensory experience of the penis. Some men report a decrease in sensitivity, while others find no significant difference or even prefer the change. Large-scale studies have generally concluded that circumcision does not negatively impact overall sexual function, arousal, or satisfaction for the majority of men, but individual experiences can and do vary. Beyond the medical aspects are the ethical considerations, which are particularly relevant when the procedure is performed on infants. The core of this debate centers on the concept of bodily autonomy, the right of an individual to make their own decisions about their body. Since an infant cannot consent, the decision falls to the parents. Proponents argue that parents routinely make medical decisions for their children's well-being, and circumcision can be seen as a preventative health measure. Opponents contend that it is an irreversible cosmetic procedure that should be the individual's choice to make when they are old enough to decide for themselves. This conversation also touches on cultural identity, as the procedure can be a significant rite of passage or a marker of belonging to a particular community. Ultimately, it's worth noting that many of the health benefits associated with circumcision, such as good hygiene and the prevention of STIs, can also be effectively managed through other means, like consistent washing and practicing safe sex. This highlights that the decision is rarely a purely medical one. It is a complex choice that often weaves together personal beliefs, cultural traditions, and religious values. Circumcised versus uncircumcised. Let's compare circumcised and uncircumcised men to summarize what we've discussed. Hygiene: easier for circumcised men, more careful cleaning needed for uncircumcised men. UTI risk: lower in circumcised infants. STI risk: circumcision reduces certain risks, but safe practices are still crucial. Penile problems: circumcision prevents phimosis and reduces infections. Penile cancer: rare overall, but lower risk in circumcised men. Sexual sensitivity: most studies suggest minimal impact. Partner health: some benefits for female partners of circumcised men. It's a balance of risks, benefits, and personal or cultural priorities. Medical and global perspectives. Around the world, circumcision rates vary widely. In the United States, for example, newborn circumcision is common, while in many European countries, it's less so. The World Health Organization has even recommended circumcision as part of HIV prevention programs in regions with high infection rates, like parts of sub-Saharan Africa. This highlights its public health relevance, not just personal or cultural significance. Making the decision. If you're a parent deciding for a newborn, consider medical benefits, cultural or religious factors, and ethical considerations. Talk to your pediatrician about timing, anesthesia, and aftercare. If you're an adult considering circumcision, discuss it with a urologist or healthcare provider. Understand the procedure, recovery, and potential impact on sexual function. Remember, it's a personal decision. There's no one-size-fits-all answer. Myths and misconceptions. Let's bust a few myths. Myth 1. Circumcision causes major sexual dysfunction. Reality. Most research shows minimal impact on sexual satisfaction or sensitivity. Myth 2. Uncircumcised men are unhygienic. Reality. Proper hygiene works for both circumcised and uncircumcised men. Myth 3. Circumcision completely prevents STIs. Reality. It lowers risk but doesn't replace safe practices like condom use. Closing thoughts. Circumcision is a practice with ancient roots and modern relevance. It offers clear health benefits, but also comes with considerations and personal choices. At the end of the day, the decision, whether for a child or yourself, should be informed, thoughtful, and based on accurate information rather than fear or misconception. Thank you for joining me in this comprehensive look at male circumcision. If you found this episode helpful, please share it, and stay tuned for more discussions on health, science, and wellness.